Everyone here truly cares about patients and wants to see them do well. So when you walk in the door, it starts with reception and goes all the way through your time here. So every staff really cares. It's just a really friendly atmosphere. So just getting that support right after you leave inpatient is super important. And then you can have that really kind of seamless transition. I think a lot of times in between inpatient and the next step, patients get a little lost. So if you have that aftercare set up ahead of time, you're a lot more likely to follow through, and having that support in place before you leave, I think, is probably key to recovery.
So here's one of our groups. It's a safe environment. People are very open.
So primarily in the program that I work in, we use exposure response prevention and cognitive behavioral therapy approaches. So exposure response prevention are approaches for people with anxiety. Basically, it's teaching them to increase tolerance to anxiety by facing their fear without doing any kind of behaviors that are counterproductive. And then cognitive behavioral therapy is looking at the way that your thoughts interact with your emotions and your behaviors.
It focuses on changing the way you think and then also changing the way that you behave. So it's different from traditional kind of talk therapy in that you're getting skills that you can apply in the real world. And I think that that's where patients really see like actual change.
Coming here is very worthwhile.
So this is the art room. So we do a variety of different projects in here, different directives. This is for the experiential therapy groups, teamwork things. Our yoga mats and yoga blocks are in here as well. So here at Silver Lake, patients get groups throughout the day, and one of their groups is experiential therapy, and basically we offer up different experiences as far as art experiences, recreation experiences, just additional pieces that they can take with them. It takes practice, it takes some time, and so being able to be in a setting where you can practice those things and have that support, I think, is really big.
The progress that patients make is really tangible, so you can really see it. For example, I just had a patient who couldn't work because his OCD was so severe, and after completing our program, he's back to working full-time and is actually considering going for a management position.
Sometimes the changes that you see within one person in just 4 or 6 weeks can be incredible. So someone who's cripplingly anxious or really struggling with their mood or whatever disorder they have, just changing the way they think and changing their behaviors in real time can just make such a huge difference in their lives.
So I think just remembering that the things that you do now will continue to build upon and work up to things, and before you know it, you'll probably be doing the very things that you were like, no way, that's completely out. But that doesn't happen overnight. It's a process, and it really does take some time.